So I'm delighted to be here. So thank you for inviting me. And so I'm Leslie Turner. You've introduced me beautifully. Thank you, Sue. I'm a PhD student as well as a lecturer. So I'm in my third year, and I'd love to acknowledge my supervisors. So Professor Peter Griffiths, Professor Jane Ball, and Dr. Ellen Kitson-Reynolds, all here at the University of Southampton. So my topic is on staffing. We do lots of research about staffing here in our unit and also on postnatal care. And you'd be surprised to hear that there is no minimum standard for staffing in hospital wards and particularly on postnatal wards. And I was quite surprised about this because you have minimum levels for creches, for schools, for other public services to say there should be one person responsible for so many people, but not in these wards. So that's quite surprising. We do have the standard of one-to-one care in labour, but that doesn't extend out onto other areas of maternity. So that is a surprise. And with the rising complexity of women, then postnatal care is really important. And we know that they do have lower satisfaction with postnatal care than antenatal or labour care, but nobody really talks about it. So it's an area I was really passionate to look at because it has such a long-term impact on women and families and babies in terms of mental health, breastfeeding, bonding, all of those things if we don't get postnatal care right. And the effect of staff themselves. So we've talked about burnout in the past, but how much workload are staff expected to manage on postnatal wards? And that is really the key that I want to look at in terms of trying to influence policy and research and practice. So that's the topic for my PhD, but I'll take you through the steps as to where I've got to so far. So moving on. So in 2020, when the world closed down and went to sleep, we started our literature review. So we did a review to look at how many studies are out there, what do they say, do they agree with each other? And we found very little evidence actually about this. And the question was looking particularly about the quantitative association. So we were looking at the numbers to see, is there an association between staffing levels and skill mix, and then relating that to outcomes for mothers and babies? That was the question. And it hadn't been looked at since 2015. So it was looked at before the NICE guidelines came out. And at that time, there were only 8 studies that they had found. So we found that we had really something to contribute because we'd found 21 studies. And I think a couple more have been published since that time. And it confirmed what we knew, really, is that increased staffing levels is associated with increased outcomes. And you can see in the middle of the slide here some of the outcomes that were improved and some of the adverse events that were reduced as a result of having better staffing. And this research came from all over the world, so from 10 countries. And in fact, 9 of the 21 studies came from the UK. Only 3 studies included support workers, but actually there's not as much evidence as I thought. And I've been working with the researchers who were doing a lot of the nursing research, and they've got oodles of studies, and we have just very few in maternity. And I was quite surprised that there wasn't more. But you'll notice that a lot of this is in labour. So in terms of the gaps, you can see I've highlighted postnatal care, but there were other gaps. So there's not much research on antenatal care. There's not much research on support staff, even though we're using more support staff, and they definitely contribute to care of families. And there wasn't much looking at midwives combined with obstetric and paediatric staff. So we couldn't really look at the family as staff and how they work together. And really the outcomes they looked at could be expanded. So in the nursing literature, they have something called nurse sensitive outcomes, which actually, or indicators, which actually are indicators that are known to be sensitive to staffing. Things like falls and things like pressure ulcers are sensitive to staffing in nursing. We don't really have that field well developed in maternity. We do have some red flags that have been developed, but most of those are labour. And I'd like to see some more of those in postnatal care, red flags for low staffing. But anyway, this is the list that I came up with, things that I thought potentially could be sensitive to staffing that need to be studied in the future. And I can't do all of this, but these were the things thinking through what could we possibly study what outcomes could we look at? So things like wound infections, whether documentation's been done properly, whether the MEOWS scoring's been done efficiently and escalated. Missed care, there's a whole body of literature talking about missed care, so care that has been incomplete or delayed care even. And then some of the outcomes for neonates, so breastfeeding rates, weight loss, jaundice. I could imagine all of these things could be influenced by staffing. And then other things like mandatory training. I'd quite like to put on there supervision of students, actually, for our student population. And the quality of the studies themselves could be better. So a lot of them that I looked at were cross-sectional, but we could do with more longitudinal studies and possibly more individual patient data studies. So there's a whole more PhDs in here, really, but this is what we identified. I still wanted to look at postnatal care, though, because that was my passion. But I asked service users and staff which outcomes to look at. So we did a consultation. So in a lot of research studies, it's advisable that you do something called PPI, so patient and public involvement. So this was my PPI part. I did this in April 21, and this went out on social media. And 17 staff members and 28 women and families contacted me to say what they thought was important. The women and families said that they wanted more information in the postnatal period, that they wanted more physical help. So some of them had had interventions and they were struggling to mobilise with pain relief, so they wanted more of that help. They wanted help with feeding. They said they really wanted some help to get to sleep. So these wards are noisy, and that rang true for me, really. They can be really noisy places. The midwives told us that I should look at satisfaction, so patient satisfaction, delays in care, admissions to neonatal unit, and the quality of their interactions with women and families. They thought those could suffer. And now I'm just going to tell you briefly about the two studies that we've completed and published. So the first time we looked at experience of care. So we wanted to look at women and families' experience of care. And I was lucky enough to find a data source, which is the maternity survey. And this is done every single year in February. I'm sure some of you will recognise this survey. And the data is publicly available through the UK Data Service. You have to request it, but you can get hold of this data and you can match it to all sorts of other data sets. So I matched it to the staffing data set, and I firstly looked at the trust levels. So how many midwives do we have in each trust? And this is the analysis I'll show you first. So it was a survey. It went out to all women who gave birth in 2018 in February, and the response rate, got it somewhere, 37%. Response rate, which is not too bad for a survey. And I picked out 4 questions in that survey which related to postnatal care. But if you wanted to do more research, you could look at other questions because there's loads of information in there. And I would encourage researchers to maybe look at this. But the 4 questions I picked out were to do with delays in discharge, whether they felt staff helped in a reasonable time, were they given information and explanations, and were they treated with kindness and compassion? And for 3 out of 4 of those outcomes, trusts with a higher number of midwives in the organisation scored much better. And you can see some of the statistics here is that they scored much better in 3 out of 4. And the 4th one, with kindness and understanding, there was no difference. But this gives us some evidence that staffing improves the patient experience, which is what we haven't really got already. So that's new. And in terms of the size of the difference, we estimated that about 6% fewer women would have a delay in discharge. So it doesn't sound like a lot, but when you multiply that out through the whole country, that's actually quite a lot of women potentially benefiting. The next part of the research, so this is a second analysis. This was also done on the same maternity survey, but it was done the year later in 2019. And I chose the year later is that there was a new data set on the block called Care Hours Per Patient Day. And this data set adds up all the staffing hours in that period. And it also adds up how many women were on the ward at midnight. So you get some idea of workload, and it's also at a ward level. So I can drill down to see what's going on the ward rather than just what's happening in the organisation. And so there were real benefits to using this data set. And also it told me about support worker staff for the first time. So that was really good. And what we found in the top box, you can see that the findings were very similar to the other analysis. So at trust level, the number of midwives in the whole trust did seem to influence the quality of postnatal care. The middle box was a bit surprising because when we looked at the midwives on the ward, at the ward level, postnatal wards, we found that the relationship that we thought would be there, it wasn't there. And one of our explanations, it might be that the midwives might be there on paper, on the rosters, but are they really there all the time? And I've seen in the literature, and I've seen written down that during a shift, sometimes midwives from the postnatal care wards are often moved to support labour care. And it could be that they're on paper, but they're not always there. And I'm told that anecdotally that happens in practice. And in the bottom box, we did find a positive relationship between support workers and women saying that they had help when they needed it and they were treated with kindness and understanding, which shows some support for their role in that area. But this analysis is not all. So I've gone on to look at safety and outcomes. So this is just patient experience. And this is what I'm working on at the moment. So I've got a new data set. I love data. A new data set from the Workforce Health Outcome Study, which is a huge study. It's individual patient data, and it covers 4 trusts over 5 years. And I'm able to look at the outcomes in blue. So readmission rates, transfers to neonatal unit or back to labour ward, some adverse events and mortality. And I'm hoping this is quite a strong design, having a longitudinal design. We're linking directly. We know what exposure of staff that women have had, and we can link that to their outcomes. I don't have any results to share with you just yet, so that's just coming. And then finally, what does this contribute? So why does this matter? Is that we've been able to use quantitative methods, which is just one type of research, but we've been able to link patient experience and hopefully outcomes, but we're working on that, to staffing and skill mix. And it just gives us more information about staffing, and it gives us that evidence we really need. So this is the additional studies that we'll hopefully publish, and it supports midwifery and support worker staffing. We have used a rigorous approach, and we've published in peer-reviewed journals, so we have had the work scrutinised, but it really spotlights postnatal care and why staffing matters and which outcomes could potentially be affected. And I think that's really important. We haven't been able to do everything, so we haven't been able to account for things like staff training, whether they're following best practice and culture, and things like continuity models. So we haven't been able to do everything, but we have been able to demonstrate a link between staffing and outcomes and experience. And we are delighted that our work was noticed. So on Twitter, Professor Jane Sandor retweeted one of my papers, and Elizabeth Duff retweeted it again, and she said that this evidence underlines the urgent need for better care on postnatal wards. And she's going to come and talk to us about that. But, thank you very much for listening. And these are just my acknowledgements at the end. So thank you. And any questions later, I'm very happy to talk about it.